Normal lung function. Within the lungs, your bronchial tubes branch into thousands of smaller, thinner tubes called bronchioles. These tubes end in bunches of tiny round air sacs called alveoli. Small blood vessels called capillaries run through the walls of the air sacs. When air reaches the air sacs, oxygen passes through the air sac walls into the blood in the capillaries. At the same time, carbon dioxide moves from the capillaries into the air sacs. This process is called gas exchange. The airways and air sacs are elastic. When you breathe in, each air sac fills up with air like a small balloon. When you breathe out, the air sacs deflate and the air goes out.
COPD. In COPD, less air flows in and out of the airways because of one or more of the following. The airways and air sacs lose their elastic quality. The walls between many of the air sacs are destroyed. The walls of the airways become thick and inflamed. The airways make more mucus than usual, which can clog them. In the United States, the term COPD includes two main conditions, emphysema and chronic bronchitis. Most people who have COPD have both emphysema and chronic bronchitis. Thus, the general term COPD is more accurate. The following slides illustrate patients with COPD, bronchitis, and emphysema.
Causes. Long-term exposure to lung irritants that damage the lungs and the airways usually is the cause of COPD. In the United States, the most common irritant that causes COPD is cigarette smoke. Pipe, cigar, and other types of tobacco smoke also can cause COPD, especially if the smoke is inhaled. Breathing in secondhand smoke, air pollution, or chemical fumes or dust from the environment or workplace can also cause and contribute to COPD.
Symptoms. At first, COPD may cause no symptoms or only mild symptoms. As the disease gets worse, symptoms usually become more severe. Common signs and symptoms of COPD include an ongoing cough or a cough that produces a lot of mucus, often called smoker's cough, shortness of breath, especially with physical activity, wheezing, a whistling or squeaky sound when you breathe, chest tightness. If you have COPD, you also may have colds or the flu often.
The following treatment options are available for COPD patients.
Asthma is a condition in which your airways narrow and swell and produce extra mucus. This can make breathing difficult and trigger coughing, wheezing, and shortness of breath. It isn't clear why some people get asthma and others don't, but it's probably due to a combination of environmental and genetic inherited factors. Asthma symptoms. Asthma symptoms range from minor to severe and vary from person to person. Symptoms include shortness of breath, chest tightness or pain, a whistling or wheezing sound when exhaling. Wheezing is a common sign of asthma in children. Coughing or wheezing attacks that are worsened by a respiratory virus such as a cold or the flu.
The following treatment options are available for patients with asthma.
To view our video, please visit www.stopcape.blogspot.com.